lot of confirmation as to how you get FSGS. It can be secondary to diseases like diabetes or sickle cell disease. Sometimes even obesity can cause FSGS, or even genetic factors, which is how my two girls got it. Most individuals with FSGS, they have very little symptoms. We were fortunate enough that my oldest daughter did end up having symptoms, which was is considered nephrotic syndrome. Those are like swelling of the hands, the legs, or the feet. Excuse me. Swelling of the hands, the feet, the face, even, or your eyes. She also was having, when she would wake up in the morning, she was throwing up. She was also having protein in her urine, which we ended up finding out, which was probably the way that we finally confirmed that she had FSGS, was because of her high protein in her urine. And then we ended up taking her to go get checked or have a thorough check through and at her doctor. So that's when once she did the actual biopsy of the kidney, that's when it was finally confirmed what she had. And that's when we had to go in and get me ready to give her kidney, because she was at the end of her kidney life, which was terrifying, obviously, because no parent ever wants to have to deal with their child having to have a kidney transplant, right? But it was better than her having to have dialysis. So a lot of times, what the ways that most nephrologists actually treat or try to manage FSGS, they'll try to give you medications like to lower your blood pressure, to manage your cholesterol, and these two things are key factors when it comes to trying to manage your protein, right? Changing your diet, trying to reduce any type of pressure or any type of damage to the kidney is such a huge factor in managing something like FSGS. Unfortunately, there isn't a cure. FSGS is just something that if you have it, you have to try to manage it, and you have to try to stop it from progressing into full-blown kidney disease. When we found out about FSGS, it was already too late for my oldest daughter. She had to go in and get a transplant. So what ended up happening was, once we found out she was at the end stage of her kidney life, I ended up getting tested, and I ended up going into getting all this blood work done. I had to make sure that I tested good in order to confirm that I was a candidate for her, and to make sure that she was able to get my kidney. So thank goodness that everything worked out for us, and I ended up being a pretty decent match, actually. It was pretty high up there. The only reason